Proper documentation of patient status upon admission is a key component of the reimbursement process of a healthcare facility. This status has certain medical criteria that has to be met, which is predetermined by the insurance company. Insurance companies usually follow the national guidelines that Medicare and Interqual have set. Doctors are the only ones that can write an order that documents what the patient's status is, but nurses can play an invaluable supporting role by checking for correct documentation, if they understand what that status is and what it means to the financial solvency of the healthcare facility that employs them. Let's talk about what patient status means and how it affects reimbursement of the care the facility implemented. If a client is admitted to the hospital with an inpatient status, they have to meet inpatient medical necessity as determined by the payer, and they have to have a doctor's order. If a client visits the hospital for emergency room visits, tests, or outpatient procedures that do not require a room stay, their status is considered outpatient. The tricky part of reimbursement is the outpatient observation status. How do you document a client who is too sick to go home but doesn't meet the criteria for an inpatient stay? If the client is admitted under observation and his condition deteriorates to a place where he meets medical necessity for an inpatient status and receives a bed, but the doctor never changes the order from outpatient observation to inpatient status, the hospital risks denial of coverage. If the doctor doesn't order the correct status, you can't bill for it, and the doctor is unable to go back after the client is discharged and change the order they originally documented. This is a basic overview of an extremely complex system that involves many entities, evolving regulations, and nuances of interpersonal relationships of departments within a healthcare facility. Which brings us to the nurse's role in catching admission status errors. Every time the nurse provides procedural care for a patient, the action and patient response has to be documented. Each time the electronic record is opened for that documentation, the patient status is stated on the first page. Training a nurse to take 10 seconds to double-check the status of a patient's admission to ensure it reflects the level of care the patient is receiving will increase reimbursement and contribute to the financial solvency of the healthcare facility. Doctors and nurses can easily get frustrated with this complex system that seems to change with each entity that is involved. No matter the documentation, their level of care for the client is the same. Creating an awareness of how their documentation directly affects reimbursement for the care given is crucial. Nurses paying attention to this one little detail can help ensure that a healthcare facility is properly reimbursed for the care they provided patients and will contribute to the financial stability of a facility in a competitive and unstable healthcare environment.